Assalamu alaikum and welcome to the Medical Black Book. Our today's topic is
Disaster management. There are various types of disasters that are occurring everywhere, such as typhoons, tsunamis, earthquakes. So, in order to provide relief to such areas, we need to know how to manage such circumstances. So, before starting or managing such an area, we need to have a disaster plan. The disaster plan is composed upon firstly establishing a national level disaster management organization which can overlook such problems. Then after a disaster has been caused, we need to anticipate the level of disaster, that how much area it is being covering or how much casualties are present there. Then, for the survivors, we need to have an evacuation plan and we need to mobilize emergency services to that respective area. And for the injured, we need to have a medical plan. Now, sequence of relief effort in the major disaster area. Now, how do you provide relief? You provide relief by first establishing a chain of command in which every person or every group of people are giving a specific function in order to provide relief. Then the next step is to set up lines of communication, carry out damage assessment, mobilize resources, initiate rescue operation, and perform triage on the patients present there. Triage is basically prioritizing the patient in respect to that injury they have received. And immediately on such patients, we start emergency treatment and we evacuate such people, or such ambulances are requested for in order to transport them and provide them with definitive care. Then essential casualty evacuation. This includes when you are transporting such a patient to a respected area for definitive care, you need to retriage them to upgrade their priority among the injured that are being present in order to select a proper medical facility for them and choose an appropriate means of transport. During such a transport, you always need to prevent secondary injury during transporting such a patient and to ensure adequate supply of material to accompany with the patient. Then next is, what are the common diseases caused in these disaster areas? The most common diseases are first tetanus, nectarizing fasciitis, and gas gangrene. Definitive management for tetanus. Now, tetanus is caused by a bacteria, which is the incubation period of this bacteria is approximately 7 days. It can range from 4 to 14 days. The symptoms of such bacteria is basically it starts off as spasm of the muscles, which is also known as rhesus sardonicus, or epistotonus, which means having an arched back. This does not immediately develop, this develops subsequently, and these are the later phases of this disease. Including another symptom that occurs in tetanus is laryngeal spasm, due to which the patient has inability to drink water and also has photophobia and hydrophobia. In order to treat such a patient, after an injury has been elected or the wounds, certain type of wounds are present on such patients, we immediately give them 0.5 ml of tetanus toxide. If the wound is deeply cavitated, we give approximately 250 to 500 units of human anti-tetanus globulin. After giving them injection of this, we avoid any type of manipulation for about 2 to 3 hours. Along with that, we give IV administration of about 10 to 24 multiplied by 10 power 9 units of penicillin for about 10 to 14 days to inhibit any sort of secondary bacterial infection. Now, the wound is not closed after you give them injection because the tetanus organism is an anaerobe, so it does not require oxygen for its growth. So if you leave the wound open, that wound will be more oxygen exposed, since because of that bacteria will not grow. So after you have given all the injection and given them penicillin, after the wound has started to again after the wound starts to begin to heal itself, we then close it. This is also known as delayed primary exposure, or we leave it and let the granulation tissue form in that area. That is healing by secondary closure or secondary intention. If the patient presents to us later in this disease, they have convulsions and spasms. So, in order to relieve spasms, we give them diazepam. If the patient has laryngeal spasm, we put the patient on a ventilator so that oxygen is continuously given to that patient, and we start them on anticonvulsant. When they are relieved from any sort of convulsions, we slowly wean them off from the ventilator and still continue the anticonvulsants in order to avoid further spasms. Our next disease is necrotizing fasciitis. This is a rapidly spreading infection of the facial plane leading to necrosis of the underlying skin and the subcutaneous tissue. This is caused by beta hemolytic streptococcus. Rarely it is caused by staphylococcus, clostridium, proteus, and pseudomonas. If this necrotizing fasciitis occurs on the abdominal area, it is known as Melanie's gangrene. If it occurs in the perineal area, it is known as Fournier's gangrene. Along with necrosis, there are other symptoms including fever because the continuously inflammation is going on in that skin, and sepsis. This can lead to renal failure because of the serious collapse and the septic shock. Now, such condition can be diagnosed clinically by just looking at them, and we can do it biochemically by assessing the creatinine kinase level, which is increased in such conditions, or by doing biopsy. Treatment of such patient is first by admitting them in the ICU because this is a very grievous condition, and giving them oxygen. Now, what type of oxygen would you give? We give a hypercarbic oxygen because it has a bactericidal activity. Also, along that, it increases the neutrophil function and improves the wound healing. Along with that, we give high dose of penicillin in order to kill this bacteria, or third generation cephalosporins along with metronidazole. After some time, we remove the devitalized tissue every 24 hours till the abscess formation decreases, and we dress that wounded area with a fluffy gauze. Our next disease is gas gangrene. This is seen in missile wounds, crush injuries, and high voltage electricity. This is caused by Clostridium perfringens. Clostridium perfringens produces three types of toxin: alpha toxin, phi toxin, and kappa toxin. Alpha toxin destroys the RBCs, WBCs, and platelets, whereas phi toxin destroys or suppresses, it causes myocardial suppression, whereas the kappa toxin causes destruction of the blood vessels as well as the connective tissue. The incubation period of this organism is less than 24 hours, and it can range up to from 1 hour to 6 weeks. The earliest symptoms in this disease are pain, myonecrosis, in which the muscle slowly begins to degenerate. There is swelling of that respective area, discharge coming out of it, and it has a particular odor which is sweet or grapey. There is also soft tissue crepitation, increased temperature, and later on in disease there is altered mental status. Diagnosis of such a cause or such a disease is by peripheral blood show, which tells us there is hemolysis is going on. In the biochemical profile, there is metabolic acidosis. On radiology, we see gas in the soft tissue. Treatment of such a disease is by giving the patient high dose of penicillin G or clindamycin, third generation cephalosporins, and surgical excision of the devitalized tissue. And if it is not salvaged, we can amputate that respective area and give the patient hypercarbic oxygen. Now, the principles of damage control surgery is to give minimum need to allow safe transport of the patient to that facility, to secure the airway and prevent increase in intracranial pressure by burrow hole craniotomy, and by controlling the bleeding and prevent infections.